So we'll review the suprahyoid muscles and infrahyoid muscles. So in the anterior triangle, I'll just go through the boundaries. We have the median line of the neck, which forms the anterior boundary. The superior boundary is the inferior aspect of the mandible. And then lastly, we have the anterior aspect of SCM. And in this particular triangle, we find suprahyoid muscles, which are above the hyoid bone. Here's the hyoid bone. And we have infrahyoid muscles, which we find below. A few other markings that I'll just highlight. Here we have the thyroid cartilage, the cricoid cartilage, and then one of the tracheal rings. There's a bunch of tracheal rings below. So within the suprahyoid group, in the superficial layer, we have mylohyoid, which helps to form part of the floor of the mouth. Here we have digastric, and if we follow digastric around, so these are the two bellies of digastric. So here is the anterior belly and the posterior belly. And above digastric, we find stylohyoid. So here's stylohyoid. So the one that's above is stylohyoid. And stylohyoid has a little bit of a hole in it for digastric to pass through. Okay, so here's digastric. Deep to mylohyoid, we find geniohyoid, small one here. So we have it on either side, we only can see one of it. So there are 4 suprahyoid muscles. 1, 2, 3, and then stylohyoid up here. So in the infrahyoid muscle group, we have 4 muscles again. 2 that are superficial. Okay, so we have sternohyoid, which runs from the sternum to the hyoid bone, and we have omohyoid. So omohyoid actually starts over here on the scapula. Sorry, it runs from the scapula and runs up. It goes underneath sternocleidomastoid, and here's the other part of it here. So omohyoid is anchored down to the clavicle. And deep to omohyoid and sternohyoid, we have sternothyroid, so it runs from the sternum to the thyroid cartilage, and then thyrohyoid, which runs from the thyroid cartilage to the hyoid bone.